turn now our attention fully to the newest health issue of concern, the monkeypox virus, which yesterday was declared a public health emergency of international concern by the World Health Organization. And joining us now to share his considerable know-how on this disease is infectious disease expert and virologist, Professor Oyewale Tomori. Good morning to you, sir. Thank you for joining us on the morning show today.
It's my pleasure. Thank you very much.
Thank you very much. But let's start off with the World Health Organization's declaration of this being obviously an international, a health emergency of international concern. Talk to us about monkeypox, and then specifically, if you can clear up the relevance to perhaps the homosexual community, a community of men who engage in sexual activities with other men. How does this virus affect them? Obviously, this is not in you. I don't want to speak for you, but let me walk you back. Tell us about this monkeypox virus and how specifically it pertains to homosexual men or men who choose to have sexual relations with other men.
Thank you very much. Actually, the disease has been known for quite a long time. I think it's an aberration. They call it the monkeypox. The monkeys that got infected came actually from Singapore into Denmark. And that's where the first cases came. So the virus must have been among the laboratory animals in Denmark before those monkeys came in from Singapore. And we've had examples of monkeys from different parts of the world getting infected. So the virus is probably all over the world. And unfortunately, like I said, the monkeys got the name, and that's what it is. Now, I mentioned the fact that it has been going on in other parts of the world. Apart from the 1958 case that they had in the monkeys, the first time it was reported in Africa was in 1970, and that was in DR Congo. And then we had our own in Nigeria in 1971. We had 2 cases, I think, at that time. And then we had another case in 1978. Nothing happened until 2017. The transmission within our own region, Africa, and that is DR Congo and Nigeria, has really not really been associated with sexual transmission. It has been people mixing or contacting with the reservoir, which we still don't know, and then spreading it amongst the people. Now, what happened last year, this open soil where it was popping up all over the place in the world, was actually because it got into the homosexual community. And during one of their festivals, which they had in Spain and other places, they went back to their different countries and the virus was popping up. So it was quite unusual because we didn't understand how. But now that we understand how it came about, the unusual side of it is gone. And in Europe, compared to what is happening in Africa, most of the cases, 99% of the cases, are actually amongst homosexuals. So it must have been got into their community, they got themselves into their festival, and then began to spread it. And so there was panic, and everybody was scared about it. If you remember, you mentioned the fact that WHO has now declared it a global public health event of international concern. First of all, the committee that met didn't agree. It wasn't a unanimous decision. There are more people who said it should not be declared. But WHO, Tedros, kind of overruled. And I can understand why you overruled. The pressure on the side, what you showed with the New York thing, the pressure is more from that side. And let's be frank with ourselves. The World Health Organization is not ruled by us. It's not directed by us. The donors decide what happens. So that's what they want. And they got it through Tedros. I'm sorry to say. And then one other message I think we need to get, we don't have to wait for the world to declare something in emergency before we start taking action. See what is happening in New York. Like that reporter said, the emergency has already started. And they're looking at it and said, nobody was waiting for the WHO to declare, which is what we do in Africa. We had a national emergency way back in 2017. What did we do about it? These are some of the issues we'll be looking at. We shouldn't be waiting for international declaration before we take action. African countries must wake up and do what needs to be done when they have problems in their country, rather than wait for the world to determine for. And I don't see this declaration making any difference in what is happening in Africa right now. It will make a difference in Europe. They've already started doing what they need to do anyway. I mean, they've started getting their vaccines out and all that. They're not waiting for international declaration. It's only us in Africa that are wasting our time waiting for international declaration when we should be doing what we need to do, when we have emergency before us. 2017 was when we had a problem in Nigeria. Till now, what have we done?
All right. Well, like you have said, the WHO, while declaring monkeypox a public health emergency of international concern, described the outbreak as one that is concentrated among men who have sex with men, especially those who have multiple partners. Now, clearly, we have a gay community, a homosexual community in Nigeria that is basically outlawed. How much sensitization can the Nigerian government really conduct in this regard? Because, you know, the WHO is saying that it is an outbreak that can be stopped with the right strategies within the groups, within the right groups.
Fantastic. The right strategy depends on getting the right information to the people. I mean, if your strategy is based on pretense or falsehood, you're not going to solve the problem. It is true that it can be spread by homosexual activities. We've seen that in Europe. But homosexual activities, for example, is not that, I mean, we've not seen it's not in our region, but it's not that much here in our places. It's quite a major thing over there. And therefore, they are getting the spread. In Nigeria, if we're going to do this, to inform the people what are the mode of spreading, how you can get it, direct contact, and all those kind of things. Get that right information out to the people, and then you'll be able to do a proper control of the disease. It's a self-limiting disease on its own. If you quickly do your surveillance, do your laboratory diagnosis, and isolate the person, and keep such people away from other people getting in contact with them. And that's all. So that's what we need to do. Get the right information to our people. This is how you get it. These are the virus spreads through the pulse, and this is, don't contract the person. When you do a proper identification in the laboratory, which means we need to strengthen our surveillance and strengthen our laboratory activities. What we are having right now is a National Center for Disease Control, being the only lab in the country that is doing that. And I know we have capacity to have other labs do that. We need to get the National Center for Disease Control, coordinate the activity, decentralize the surveillance and the laboratory activities to the state level, rather than wait for everybody coming to Abuja to come and get the solution to go and get tested. We lose the chance of responding as quickly as possible.
All right, Prof. 16,000 cases globally in more than 75 countries, more than 4,000 of which in the last week alone. How much of Nigerian or African emergency case is this? We know that, yes, WHO was divided over whether to actually label it an emergency or a disease of concern. But then, is this something that our level of worry in Africa should be at the same level as that of, in America and in Europe? How much is it affecting us? A few people have died in Nigeria, a few cases here and there all over the places. What will you have government do, and in which specific areas, if you think that is also a concern to us in Nigeria and in Africa?
Thank you very much. I cannot fight with the people in Europe who have decided it's an emergency. It's their decision. It's their people. It's the way you look at things. We have a different attitude here. We don't take too many things seriously. Our government doesn't take things seriously. We ourselves are not taking too much care about our health. Over there, immediately the first cases came out, they started making noise. And that's a place where government is responsible to the yearnings and the cries of their people. We have the saying here also. I mean, we say the child that is crying is the one that draws attention. So those guys were crying and they drew the attention of their government, and that government is doing something about it. We here don't cry about it. We think we have other problems, survival and all that. Monkeypox is just how many people are getting it. Between 2017 and now, there are only 500 or so cases in the country, 1 or 2 deaths or something of that nature, compared to all the other things that are killing us in this country. So in the estimation of the people of Nigeria, or even Africa, it's a minor problem. I mean, that's the way it is. And in any case, even the big problems that we talk to our government about, they don't do anything about it. So what the hell? Sorry to use the word, but what are we talking about? So, but I think people must realize that it's a problem. You can get it. The person who has it, can contaminate the environment where you are, and you too can get the person. And until you do proper diagnosis, you don't even know whether it is one kind of rash or the other, and therefore you can be infected. So we should take it seriously. One life, one death is enough to make to do something about it. And that's why I think we're too complacent in our own area here. Our government doesn't care about us. I'm sorry to use the word. Over there, the votes count. Over there, they know that if the people say, if they are complaining, they are going to get out of the government the next time. Here, it doesn't really that matter, does it? So that's why the problem. So we ourselves as people need to begin to shout to our government, let's do something. Also, the government must be responsible to the yearnings of the people. Now, what is happening? The situation with monkeypox in Nigeria is not even as bad as it in the DR Congo. The situation is even worse over there. There have been more cases. There have been more people dying. But again, typical African country, we're not doing anything about it. We're waiting for WHO to declare for us that this is an emergency, when we know it's an emergency ourselves. So it's us to change our attitude ourselves within our people. Also, government to listen to the yearnings of the people and what they are making noise about, when they are raising up their voice about what is concerning them. But we ourselves must be really sure that this is a problem. You saw our attitude to COVID. So the same thing. I'm not surprised that we're looking at monkeypox as it is.
Yeah, but Prof, what are people's chances if push comes to shove and you contract it? What are your chances? What's survival rate like? Are you able to break it down? You mentioned COVID. But people think that, yes, worst case scenario, you get to isolation center, there are drugs to take, there are protocols to follow. What is it for monkeypox? What are people's chances if you do contract it?
The good thing about monkeypox, as I said, it's a self-limiting disease. You get the pox, you get sick, you have fever, you have pains at the lymph nodes and all that. If you're probably isolated and kept, hygiene around you, you'll survive. In fact, you may end up with no permanent scars on your body, except, of course, that thing is infected. There's a bacterial infection, and then you get sores and marks on the face. But ideally, when the disease comes, it's a very mild infection. Isolate the person, do proper hygiene, ensure you don't contact anybody. So it becomes self-limiting, and that's the end of the story. Mortality is less than 1%. Nobody wants to die, but mortality is less than 1%. That's one thing. I mentioned the DR Congo, where deaths may be as high as 10%. Then that becomes something very worrying. We have not reached a level where most of our studies here have been, maybe, like I said, less than 10% totally. This year, I think we had 2 or 3 more deaths. So, as a disease of severities, is not one of major severity. It is self-limiting. If you take proper care of the person, if you isolate the person and ensure that no other person gets it. So that's the situation with it. And unfortunately, with that, as I mentioned, even COVID that was more severe, our attitude to it was wrong. So this one, I don't expect too much excitement on our people that, oh no, monkeypox is around the place,
If we look at the report that played right before we came to you, it was based out of New York, and you had people in New York calling for better access to vaccines. Over in the United Kingdom, hospitals across the country, definitely in London, have started small compared to the COVID-19 drive, but small instances where they offer walk-in services for people to come in, especially if they're from specific communities, to have access to vaccines during this monkeypox outbreak. When it comes to Nigeria specifically, do you think that at this point in this international outbreak, vaccines or the availability of vaccines is something that should be a priority in this country, or is it a situation that, as you said earlier, though this is a serious virus, if properly treated, someone can nurse themselves out of it without too much external support? When it comes to vaccines and Nigeria, do you think that Nigeria should be positioning itself in order to be able to start vaccinating its own populations against monkeypox virus?
Thank you very much. First, you saw in New York, you showed they are also having problems even with the vaccine. So there's not enough vaccine around, either in Europe or whatever. WHO has a stockpile, but it's very minimal. US government has a stockpile, but it's again minimal. But also remember that the majority of people are shouting, who are making whatever, all these protests, and 99% of them are in the gay community. That's the first point. To me, I don't think vaccine is a priority for us in Nigeria. Our priority would be to proper disease surveillance, identification, isolation of the patient, As I mentioned, it's a self-limiting disease. I think we can achieve more by following that one than looking around for vaccine, which is not available. And then bear in mind the stigma that is now associated with it, it's going to be turned upside down in Nigeria. Oh, this homosexual are going for vaccine for that one. We should avoid that. But for me, I think our priority is not the vaccine, which is not even available to start with anyway. Our priority is, I keep repeating it, decentralize our surveillance, get people to identify it as quickly as possible, get our laboratories working to make it, isolate those cases, and then treat them with proper hygiene around infection prevention and control, and we can forget about this. I mean, it will take Peter itself out. It's been around, as I said, since 1970s when we had infectious disease. What we should begin to find out, why is there an upsurge now? Is it because of people's behavior? These are the things we should be investigating in our region. This is what should be contributing to what is going on. Unless we understand the epidemiology, the source of the infection, where are we getting the infection from, we will continue to have the problem we're having. Like I said, between 1978 and 2017, there were no cases in this country. Maybe we're not detecting them, but suddenly it became quite real. Something must have happened. A change in human behavior. Association and increased contact with the reservoirs, which we still don't know. So those are the questions we should be working on. Our government should be getting, NCDC should be getting involved, that kind of thing. Disease surveillance, identifying the reservoir, so that when we know where the source, then we know how to avoid it. If you don't know where it's coming from, then you can't avoid what you don't know.
Well, I believe Steve has touched on some sort of statistics. I'll just take it from there where, the research has indicated that the disease is a much less severe cousin of the now eradicated smallpox virus. Like Steve said, globally, there are over 16,500 cases reported in about 75 countries. Studies also show that it is endemic to parts of West Africa and Central Africa where the disease is usually contracted from, rodents or small mammals. Now, the Nigeria Center for Disease Control has banned the consumption and sale of wild animals to contain the virus. But you know that the practice is still prevalent. What more can be done? And also, I'd love for you to touch on more on preventative measures. You've talked about, treatment and all of that. I'd like to know how this can be prevented once you have caught the virus. We know that it goes through, bodily fluids, sores, or items such as clothing and bedding when contaminated. We also know that it can also spread from person to person through respiratory droplets, typically in a closed setting. How can you prevent this infection?
First of all, we go around banning things without understanding the basis for it. So there's a federal government thing, ban Bushmeat. What does that mean? It's something you can't even implement. And what does it mean by ban Bushmeat? What does it mean? I should stop eating Bushmeat. Let me bear in mind that where is the source of the virus? It's not in the cooked meat. It is in the raw animal that you trap in the bush. Therefore, the focus will be not on me eating bushmeat, but on the guy who is in the field trapping those animals who get exposed first. So we should, when we give out information, we should follow our regulations based on information. The man who is eating real meat at the bukateria is not likely to get monkeypox, because your pepper and your heat has wiped out the virus. The man that I should be worried about is the hunter in the bush, who is looking after getting those rodents and who is getting contaminated with the blood and the distance of the rodents. Again, we don't even know what rodent it is. So that's the starting point about all those stupid, laws that are not going to make any sense about banning one thing or the other. That's number one. Number two, the important thing, prevention is don't get infected with somebody who has it. And that's what prevention is about. Once you get it, depends on your own state of health. You may come up with a severe disease. Like people who have HIV or immunocompromised people, they get a more severe disease than others who are normally. Under normal condition, if you are healthy and you get this disease, like I said, it's going to be a self-limiting disease. But we also want to be sure that you don't spread it to somebody else. Your mentioned that the fomites, the cloths, and all those type of things that people wear are the sources of where people can get contaminated. So once we understand that, it is tailor our message to see how you can stop people getting contaminated or being through direct contact or contact with fomites and so of that nature. These are the messages that we should be passing out. Not to create a panic situation or create a stigma that is only among homosexuals or something of that nature. Anybody can get it. And that's that. And our message has shown in Nigeria. The number of cases we've had over this since 2017 has shown that anybody can get it. People, friends, relations, family members. What matters is the closer the contact, the higher your chance of getting infection with somebody who has the disease.
All right, Prof. I was actually tempted to ask for your opinion on the propriety or otherwise of eating bushmeat, because you mentioned it. We've always had animated discussions about it in the studio together with our colleague, Leila Johnson-Salami, who's an advocate of not eating bushmeat, especially those that are banned. So I'm not sure whether I should proceed or not, but what do you think about bushmeat, actually?
Please go ahead. I mean, I think it's important to inform people.
Yes.
So that they get the proper information, and not just, like I said, federal government get in and say ban bushmeat. I think it is a wrong approach because they have not understood the basis for the banning. Where do you get the virus? It's not at the bushmeat that has been cooked and peppered and salted. No virus will survive that. The problem is at the beginning when they go looking for those animals in the bush. And they get exposed, they get injuries, they discharge, fluid, blood from the animal, gets into somebody's hand who has an injury, and he gets infection. That's the one that we should be worried about, that will get monkeypox. Not you at the end, after the food has gone through all the process, and you have cooked it and you're in the bukateria eating the bushmeat, you're not going to get monkeypox from that. So our effort should be on that area. How do we ensure that those who are trapping those rodents, will not be the one that will get the infection? And of course, we can't stop it because we don't know which rodent has it. Therefore, that's where surveillance and laboratory diagnosis becomes very important. Immediately you discover, you note, you isolate, and you keep. And that's what is happening. And that's what I'm saying. Blanket banning doesn't solve the problem. In any case, who is going to implement it?
Well, correct me if I'm wrong, Steve. I believe his question is to you personally.
Yes.
What do you make of the consumption of wild animals, bushmeat?
You're asking me or you're asking Steve?
No, I'm asking you, but I'm just hoping that Steve...
And I'd like to add... Okay, Prof, I'd like to...
For example...
Okay.
Yeah, for me, personally, I have nothing against bushmeat. I mean... these are sources of meat for our people. If we organize it very well, there's nothing wrong with it. Absolutely nothing. The only thing I'm worried about, like I mentioned initially, is that the man that goes on to the bush to go and catch those meat, those are the ones I'm more worried about than you that are eating it in your office or in the bukateria. There's no really major problem about bushmeat. Of course, those who are like animal conservators and all that will also argue you're depleting the whatever. So it's a balance of life.
Okay,
you go into the jungle, the animal... The lion is eating the giraffe. So that's food chain. That's the balance of life. We can't complain about that.
Okay, just to be clear, Prof, apologies that I'm sticking with this issue. So once we have it cooked, peppered, and salted, do we have a scientific pass mark to proceed and consume? Is that what you're saying?
Yeah, at that level, even the toughest of viruses will have been destroyed. In fact, it adds more to your protein.
Great. Thank you, Prof.
I mean, let's be frank with each other, and that's the truth.
I think the challenge more is not the consumption. I think it's just the way it may spread. I mean, if you're talking about cooking and, getting rid of the virus through cooking, I think that should be fine. But what about, the way that we sell the bushmeat in Nigeria? That's the process.
Thank you. You raised a very important point. I distinguish between the two. I said the problem is not with you eating the bushmeat. The problem is with the man who is trapping the animal in the field. That's what we need to address, not you, when the meat has got into your table. How do we address and ensure? And I made a point and said, when we can't prevent that because people will continue to hunt animals, whether we like it or not. We don't know which animal has the monkeypox. But if our disease surveillance at the level, village level, anybody you see can have the attention in the hospital, people do a proper diagnosis, we can nip this thing in the bud. One case, the cases that become global starts with one single case. So if you take care of that one single case, there's no global problem. So that's where we should focus our emphasis. Those guys in the field who are collecting those animals, who are killing them, getting infected with the blood and all the things of those animals, that's where our emphasis should be. And that's why I'm saying our study should go and even pinpoint and identify which specific rodent has the virus. You don't go into the bush and say every rodent must be killed or we must not avoid it when you don't know which one is carrying it. So we have not even started the basic studies to find out where is the reservoir, where is the host. And then you know what to advise your people on where to go.
All right, Prof, I'd like to ask you an important question to me. Is the scientific and medical community in Nigeria picking up any development as to the nature of malaria and malaria treatment these days, especially at this flu-like season, this rainy season? I do not have any specific statistics, but I've had on a number of occasions people talking in terms of treating malaria as though they are treating COVID-19. Is there a correlation? Because the sort of malaria that people are getting these days seems to be a lot more intense, and the prescriptions, look like they are treating COVID. So are you picking anything up in the scientific world that suggests that maybe whether you are vaccinated or not, we're still dealing with this disease and we're treating it in a manner that seems similar to malaria, but then is here with us, we have to live with it, and people will just have to accept the fact that, yes, when you say that you're dealing with malaria, maybe 70-75% of the time, you're probably dealing with COVID.
Thank you very much. When the whole issue of COVID came, everybody came giving, like I used to say, we're all ignorant people, whether in Europe or Africa. We didn't know nothing about this virus. So we're all living in ignorance. Unfortunately for us in Africa, we wait for the ignorant people to tell us what to do. Both of us are ignorant. The blind leading the blind. That's what has happened. But back to your question. This decision we're getting, you recently heard that Biden had COVID.
Yes.
Despite the fact that he has had his vaccination booster, people are getting infected. No doubt about that. I mean, this is a virus which, I used to say this is a virus which is smarter than all of us in the way it is behaving. So you get your booster, but then in the process of those who are getting infected, who are not vaccinated, they are creating the variants that are nullifying the effect of our vaccination. So it was Delta, it was this, now it is Omicron, it was BA1, BA4, BA4, and this virus keeps changing, all based on us. If I don't get proper immunity and the virus comes to me, it tries to adapt and becomes a variant which will affect you that have gotten your booster. And that's why we keep getting people who have been vaccinated getting infected. So it's a global thing. I mean, like you said, if it was one virus that had no variant, and it was just the same one, we would have no problem by now. Just like yellow fever, you vaccinate against yellow fever, and you can go home and rest for the next 10 years or more because there are no variants. But this is a virus that's adapted, and it's adapting, and it's changing. And part of it, we are also helping it to adapt by not properly vaccinating our people. So half immunized person, quarter immunized person gets infected. The virus manages to survive that, becomes something else. And those of us who are fully immunized then get this new one, and then we get infected. Again, bear in mind that immunity will wane with time. I mean, we know that. I mean, I got vaccinated last year. My immunity level will probably be lower this year or something like that. Those are factors we all are aware of. Back to your question, are we doing what the Nigerian situation is? Remember the origin when COVID started, it was almost like malaria the symptoms are very much similar to malaria, apart from, the respiratory side of it, that kind of thing. And then there are attempts to repurpose some malaria drugs to take care of it. For me, we're not doing enough in Nigeria scientifically, to solve this problem. As I said, we are waiting to hear from outside before we even take action. For example, if you ask me now, what variant is causing the upsurge that NCDC is reporting? Nobody can tell us because we're not doing the right thing and sequencing something. So when you wait for people to decide for your fate, that's what happens to us. Now we're total in confusion. Is this malaria? Is it this one? Because we're not doing what we should do. And it requires a little amount of money, putting money in the right place. One sorry to use the word, one APC form, the cost of it will do a lot in scientific research in this country. I mean, these are some of the areas I think we need to address our issue. Where is our priority? The health of our people or the looting of our resources? These are issues I think we need to begin to look at and find out. So when people from outside give us information, it's like the word of equity. Equity itself is a matter of self-interest. You remember when there's turbulence in your plane, and they said the oxygen mask is coming on. What did they tell you? They said, take care of yourself first before you take care of your child. No, so the same thing with equity. Equity talks about self first before you can begin to talk of somebody else. You take care of yourself first. And that's the Bible did not say love your neighbor more than yourself. It said love your neighbor as yourself. So you need to love yourself first.
We have to thank you, Prof, for a brilliant submission as always this morning. Thank you so much.